So, Ros, this review will look into the evidence for the use of stage 1 and stage 2 hormone treatments for children with gender dysphoria. So this would include puberty blockers as well as hormone treatments. And this was a review that was announced today by the Health Minister here in Queensland, Tim Nicholls. It will be done by an external reviewer. We're yet to find out exactly who that person will be, but the government says it will determine the terms of reference for this review with that reviewer. The people who will be consulted for this review will include clinicians, but also people with lived experience. But the government says that while this review is underway, it will be putting a pause on any children or anyone under the age of 18 from accessing stage 1 and stage 2 hormone treatments within the public health system here in Queensland.
And what's prompted the review, Jack?
Well, the Health Minister, Tim Nicholls, spoke about the Cairns Sexual Health Service in the state's north today. He said there'd been an apparently unauthorised provision of paediatric gender services within this service. He said this had resulted in 17 children receiving hormone therapy that, quote, may not align with the accepted Australian treatment guidelines. Now, in light of this, beyond the broader review that I mentioned before, the Minister also announced 2 other separate investigations into this service in Cairns. Here's more of what he had to say.
It's critical that children and adolescents with gender dysphoria have appropriate diagnosis, care and treatment in line with guidelines and accompanied by appropriate documentation. We need to find out whether the children who have been treated in Cairns have been appropriately treated when it appears that it is otherwise.
And how many children will this affect?
Well, in an earlier review of the Queensland Children's Gender Service that was only conducted last year, it was estimated that about 547 children and adolescents were receiving care as of about June last year. And there were also about 491 patients who were awaiting care. So that gives you an understanding of the numbers that we're talking about here today. But as I said before, in the meantime, while this broader review is underway, the government has put a pause on any new patients any new patients under the age of 18 accessing stage 1 and stage 2 hormone therapies in the state's public health system. Ros.
Thanks, Jack.